Good morning and welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha Abalada and my co-host today is Dr. Danielle Williams, Medical Director of Street Medicine, and we are reporting on the week of August 24th, 2020. As health professionals rooted in Oakland serving some of the people most vulnerable to catching and getting sick with COVID-19, we are here to cut through the noise to give you the information you need to make the best choices you can to keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking in 15 minutes every Tuesday morning of every week and to answer your most pressing questions. So please submit your questions in the comments, by direct message, or by email to admin@rootsclinic.org. Now, we know that even though this pandemic is worldwide, the impact is very different depending on where you are. So we're here to give you information that is up to date and local and specific to Oakland and East Oakland in particular. Cases and deaths continue to climb in Alameda County. We now have over 16,000 cases in the county, with over 6,000 of those being in the city of Oakland. One of the things we are most concerned with and are watching closely this week are the hospitalization and ICU rates for COVID-positive patients. Last week, we reached new heights in terms of ICU occupancy, reaching as high as 73 ICU beds occupied with COVID-positive patients this past Thursday. As of Friday, we were at 69 beds and 74.1 of our county's ICU bed capacity. This means that there is 25.9% occupancy remaining as additional patients become sick with coronavirus. I want to point out here that ICU capacity is one of the indicators that lands counties on the governor's watch list. So we are now at 25.9 remaining occupancy, and if we drop below 20%, this will land us on the governor's watch list for this indicator. As you probably know, the governor's watch list is the tool being used to determine when and how counties can begin reopening. Now, mind you, we are already on the governor's watch list for two other indicators, testing and new cases. We certainly seem to be heading in the right direction as it relates to increasing testing capacity across the county, so I won't spend time on that today. The second indicator, the one that has gotten us and kept us on the watch list, is whether we have kept new cases under 100 per 100,000 residents over a 14-day period. Alameda County has not been able to meet this metric for quite some time. And according to the most recent available data, we are actually at 214 new cases per 100,000 residents, more than double where we need to be to get off the watch list for this indicator. I also want to point out here that all of these indicators refer to the entire county, not to a city and certainly not to a zip code. So for example, if we look at case rates per 100,000 for the entire county of Alameda, we are at 993 per 100,000 residents. If we look at the city of Oakland, we are at 1,571 per 100,000 residents. And if we look at the 94603 in East Oakland, we are at 3,265 cases per 100,000 residents. This is more than triple the case rate of the county as a whole. So what does that tell us? That when we look at indicators for the entire county, they are not necessarily relevant to where you live or where you work. So, given that we're on the watch list for 2 out of 6 indicators that the state is watching, and that we're heading in the wrong direction in one of the most worrisome indicators, ICU bed capacity, it may be confusing that we are seeing an easing of some restrictions in Alameda County. Specifically, beginning this Friday, August 28th, outdoor personal services, outdoor wineries, and outdoor swimming pools will be allowed to resume. Although these activities may seem fairly low risk because they are outside, the risk level depends to some extent on how much the virus is circulating in your area. Remember that this decision is being made on behalf of the county at 993 cases per 100,000. If you live in Albany with just 225 cases per 100,000, you are probably a lot less likely to come across a positive person at the swimming pool than if you live in parts of East Oakland with cases over 3,000 per 100,000 residents. If you live in Oakland, Hayward, or the Ashland-Cherryland areas in particular, positivity rates remain alarming and increasing, and you may want to think twice before assuming that what's good for Alameda County is good for you. So the bottom line is the virus is hitting Oakland harder than most parts of Alameda County, and it's hitting East Oakland even harder. That is our reality. So the decision we have to make is, how are we going to address this reality? For now, in the absence of a vaccine or a cure, and with COVID circulating in our community like it is, the best we can do is mask, distance, test, isolate, and contact trace. Now, as I have previously mentioned, all of the deaths in Alameda County have been in those over the age of 50. So as a community, we need to be most concerned about our population over 50 and even more concerned for those over 60, over 70, over 80, and so on. We must be very concerned about those living in congregate settings like shelters or long-term care facilities. If you have a parent or auntie or a grandparent living in a long-term care facility, please check on them. Give them a call. Advocate for them as needed. As of today, we have lost 100 long-term care residents to COVID-19 in Alameda County. Please check on your loved ones. At any age, you should be sheltering in place as much as you can, if and when you can. We've talked in detail previously about precautions for essential workers who may not be able to shelter in place. If you are able, shelter in place as much as possible. If others are coming around you, please be vigilant. If you aren't sure about someone else's exposure, you should not spend time indoors with them. You should wear a mask, and you should ask that they wear one too, especially if they are going to be within 15 feet of you. Actually, the county guidance indicates that everyone should wear a mask when they are within 30 feet of each other, which we agree with. So if someone is coming near you, they come to your door, they're getting close to you, it's okay to tell them to back up or to put a mask on before they get any closer, especially if you are in any of the high-risk categories. You'll also want to keep a mask handy in your home and use it in case anyone does come to your door. Most of us value our personal space. Well, with coronavirus, your personal space just got bigger. Now my co-host, Dr. Danielle Williams, will go into more detail about coronavirus and our unsheltered community members.
Good morning, everyone. I'm Dr. Williams, Director of the Street Medicine Team at Roots Community Health Center. I oversee Oakland Stomp, our street team outreach medical program that goes to various encampments and RV sites throughout Oakland, providing medical care. And lately, that has included doing quite a bit of coronavirus testing. So far, we have done over 500 COVID-19 tests for people who are living on the streets, under the freeways, and in the encampments throughout Oakland. Today, I'm going to start with the Mythbuster. Each week, we address some of the widespread myths about COVID and bust those myths with the best facts as we know at the time. If there's information out there that you want us to report on, you want to know if it's fact or fiction, submit your question through direct message or by email at admin@rootsclinic.org. This week's myth may not be so much a myth as it is a concern that many of us had in the early days of this pandemic. And we are now pleased to say that it does not seem to be as big a concern as we initially feared. And that is the concern that once COVID-19 shows up at a homeless encampment, it will spread uncontrollably. Well, as we all have now heard, as it relates to the pandemic, being outdoors is the best place to be. Of course, it is not the best place to live, and it's certainly not the best place to be stuck during these wildfires. However, as it relates to the spread of coronavirus, being outside has offered some measure of protection for this otherwise vulnerable population. Also, a tent or small structure where a person may live alone may actually help contain the spread. So while we must remain very concerned and vigilant about this vulnerable population, we remain much more concerned about those living in congregate living settings such as shelters. So far, Roots has tested over 500 unsheltered individuals for COVID-19. The positivity rate among our unsheltered population has surprised us all by being just 4.3%, which is a little less than the average for the entire county of 5.2%. By comparison, the positivity rate for our walk-up testing site in East Oakland is about 12%. We have been pleasantly surprised by this relatively lower positivity rate for our unhoused population. Now, why do we think the rate is so relatively low? I've already talked about the fact that being outdoors is probably a significant protective factor in this equation. Another factor that has tremendously helped during this crisis is the amazing network of the city, the county, the hospitals, the community partners responding each and every time there is one positive person. There has been a coordinated and concerted effort to do very rapid outbreak responses to encampments and RV sites to test everyone who may have been in contact with the positive person and make sure that they have everything they need in order to safely isolate or quarantine. We are proud to be a part of this network of homeless providers providing proactive testing and rapid response during this health crisis. In addition, Alameda County and the state of California made available hotel rooms and trailers to our county's unsheltered residents very close to the start of the pandemic, and that is to be commended. These transitional units were made available to the elderly and those with underlying conditions that made them vulnerable. They also include rooms for people who need to isolate because they're positive with coronavirus, as well as rooms for people who need to quarantine because they were exposed to someone with coronavirus. These hotel rooms have been a life-saving intervention that have protected not only the people who live in them, but also the community at large by reducing the spread. Now back to Dr. Noha for some final words.
Thank you for that, Dr. Williams. Now here's our best advice one more time. We must be most concerned about people with underlying conditions and those over the age of 50. We must be even more concerned about those over 60, over 70, over 80, and so on. We should be very concerned and check on our folks that are in long-term care facilities or other congregate living settings. People of all ages, shelter in place as much as you can if and when you can. When you're unsure about someone else's exposure or whereabouts, don't spend time indoors with them. Wear a mask when you're around them. And if they're trying to come within 15 feet of you, ask that they wear one too. This concludes today's health briefing. Please submit your questions in the comments, direct message us, or email us at admin@rootsclinic.org. Please tune in next Tuesday at 10 o'clock, and thank you for watching.